Good evening. It gives me immense pleasure to present this key achievement of this project. Before I go into the presentation, I would like to thank who have provided us support and encouragement to the team throughout the project. I would just like to give glimpses of the institutions that were involved in delivering this project. One of our key interventions were with HIV prevention program among the drug users. This has been one of the most important interventions made by the project. We have been able to establish 2 drop-in centers with the voluntary counseling and testing services to cater to the drug users and injecting drug users. The key of this program was because this was centered by and being implemented by recovering drug users to the currently using drug users and injecting drug users. This project trained about 212 peer educators who have been mobilized in conducting outreach program for STI and HIV prevention, educating on safe practices, and one of the most important thing is about this program is the clients are also linked to the available services and drug prevention services. They were able to reach about 7,004 drug users over the project period. This project also trained 262 law enforcement officers, including judiciary, police, staff of the correctional facilities, on both IDU and HIV concern to create an enabling environment for the peer educators to conduct their activities on the ground. In addition, the project also did a research-based advocacy session in a form of a play for the parliamentarians in advancing of passing the drug bill. HIV prevention program among the migrant seafarers and resort workers. This is one of the most unique programs started in Maldives under this project. This program was directly targeted the migrant workers, where 42 peer educators from 5 different languages were trained to provide information on both HIV and STI in their own languages to their own community. 63,492 expatriate workers have been reached during this project period. The program also supported linking migrant workers to the available services and encouraged them to get tested for HIV.
Bismillahirrahmanirrahim. Your Excellency, President Dr. Mohamed Sajid, dignitaries and ladies and gentlemen, Assalamu alaikum, and a very good evening to you all. It is a great pleasure and a privilege for me to come here today and say a few words on behalf of the CCM. At the very outset, I would like to throw some light onto what the CCM really is. The country coordination mechanisms, or the CCMs, are central to the Global Fund's commitment to local ownership and participatory decision making. The structure of governance provides an excellent platform that brings representatives together from public and the private sectors. Government, multi-sectoral agencies, NGOs, academic institutions, private businesses, as well as people affected by diseases. The CCM is the responsible body to oversee, guide, and make major decisions on the implementation of Global Fund projects. Over the last 5 years, the CCM in Maldives was able to create a multi-stakeholder partnership and worked well to develop a number of projects for Global Fund financing. Although, for obvious reasons, we were not so successful. However, this has given the CCM an opportunity to partner with the government to address and fight against HIV/AIDS and continue to do so in future, irrespective of a Global Fund project. As we are all aware, given the economic status of Maldives moving into middle-income countries, and the very low prevalence of the diseases primarily addressed by a global fund, the grant application, meeting the grant application criteria for Maldives is extremely slim. In light of my experience, I would like to highlight a few points for your consideration. Empowering the civil society. Investing in public health, a healthy and a productive population will be the major key to reduce the escalating costs of curative services. Prevention, of course, as we all know, is better than cure. Curbing the stigma. We have to increase our efforts to curb the stigma associated with diseases such as TB, HIV, AIDS, and sexually transmitted diseases. Before I conclude, I would like to thank all those who are involved in the successful implementation of the Global Fund project. Thank you very much for your attention. Wassalamu alaikum.
Thank you, Mr. Ahmed. Next, I would like to call Mr. Andrew Cox, President Representative of UNDP, to deliver his remark.
Excellency the President, Dr. Mohamed Wahid Hassan Malik, Honourable Minister of State for Health, members of the Diplomatic Corps, representatives of government, colleagues, ladies and gentlemen, good evening and salam alaikum. I'm pleased to be here tonight, not because we are closing the Global Fund programme, but because this is the first step on a new journey which all of us, I think, are going to be taking here in the future. I think it's only correct to start by thanking the Global Fund itself. It took 6 proposals, actually, at the beginning to get Global Fund support for the Maldives, but I think the Global Fund has realized what a significant role it has played here in supporting Maldives and partners in doing what we've heard about today. It's really been an interesting time together, and I think all of us will remember it for quite some time. I think the numbers speak for themselves. I'm not going to go through them again, but this is impact. This has meant something. We've seen hundreds and thousands of people who've been touched in one form or another by the program, thanks to the support from the Global Fund. This program is about prevention. This is not about treatment. But the bottom line is that HIV/AIDS has largely been prevented from breaking out in the Maldives, thanks in part to this project. Till today, only 17 people have been tested positive for HIV in this country, and 3, of course, are being treated on antiretrovirals at the moment. There's been, I think, a really successful effort to give a face to most at-risk groups and to talk about why their needs for HIV prevention must be met. I think one of the standout achievements of the program were the establishment of the 2 drop-in centres for drug users. This has really been very useful in linking up peers to provide information on HIV prevention, condoms and rehabilitation services. And I think many of these research activities have gone into the formulation of the draft National Strategic Plan. I'd like to thank you all for coming this evening, particularly His Excellency the President, who has had a long history of personal commitment to these issues. Thank also, of course, the Ministry of Health and our colleagues and partners in civil society. And I wish you the very best for the future. Thank you.
Good evening. It is my privilege to participate in this formal closure of the project, enhancing the response to HIV/AIDS in the Maldives, supported by the Global Fund for AIDS, TB and Malaria. Ever since the National AIDS Program formed in 1987 and the first reported case of HIV was found in 1991, the Ministry of Health is determined and aimed to prevent a possible epidemic and keep Maldives as a low prevalence country for HIV/AIDS. But the work and effort does not end here. It is my duty to inform you at this very important function In the recent years, we have generated an evidence base which confirms alarming behavioral indicators, especially among the key affected populations. Extremely high risk for rapid transmission of HIV in the Maldives. Therefore, our ambition is to keep our younger generation, especially the key populations, well informed and skillful in making informed and healthier decisions which affects their sexual health, and also support them with the most appropriate, high impact and targeted interventions. Like in many countries in the region as well as globally, we have evidence that drug use triggers HIV epidemics, as injecting drug is one of the efficient ways of HIV transmission. Similarly, Maldives is no exception, and therefore, given the country's drug use situation, we are worried and watchful. As we end this project, we would like to appreciate and consider the experience as highly educative, and it has strengthened local capacity to work with such international funding mechanisms. So I must mention our deepest sense of appreciation for CCHTC, Ministry of Health, National Drug Agency for coordinating the program, and the courage the civil society organizations, namely She, Journey, Open Hand, for their valuable and dedicated services rendered to this very important cause. I hope this remains on the agenda of the donors and our UN partners. Thank you.
Now I would like to call His Excellency the President, Dr. Mohamed Sajid, to deliver his keynote address.
Bismillahirrahmanirrahim. Assalamu alaikum. This evening, I'm really happy that I was invited to attend this meeting, because in my work, I don't come across too many happy occasions these days. And I was wondering initially whether it's really a happy or sad occasion. But after listening to the presentations made here, I decided that we should really celebrate. Because I think this program has made such an enormous contribution, I think, in very difficult areas. It's not easy to do the work that has been done in a society like ours, where this sets a precedence. Working with very difficult, hard-to-reach populations, particularly in an area such as HIV/AIDS, sexually transmitted diseases, and so on, is not an easy task. In fact, sometimes I keep wondering, having seen some of the very creative posters and commercials, advertisements on television, I kept on wondering how you do that, rather subtly, but still conveying very important messages. Because given our society, you can't make it too explicit either. So it was done quite creatively, I think. And it is now upon us to carry this forward. Although the Global Fund contribution has now come to an end, it's not because the need for the work that is being done has come to an end. On the contrary, we now have to muster all the resources we can to really stand up to the challenge and be able to carry this work forward. I'm happy to hear the resident coordinators tell us that the UN will do its utmost to help, support in whichever way they can. I think it's really a mixed blessing that we have now been graduated from an LDC status to a mixed status. Because a lot of the need for international assistance still remain, and the country's capacity to finance this very important program is still very weak. I thank the United Nations. I also thank the CCM, the officials, as current chairman had mentioned, those who came before him, who also made very important contribution for this program. But most importantly, this program has been successful because of the work of the NGOs. I look forward to working with you on making this success and continuing the program. Thank you once again, and congratulations.
Thank you, Mr. President. Society for Health Education for providing HIV prevention, outreach services to the migrant worker population, and voluntary HIV counseling and testing services. We also would like to note the following partners for their free services provided for the migrant outreach, festivals and health fairs. Dental Medical Solutions, Eye Care Opticals,
Thank you very much.
GlaxoSmithKline,
Congratulations.
Thank you, President. Journey NGO. Society for Health Education, SHE. And also Ministry of Health.
Shall we turn this way?
Thank you.